thank you for being here. We'd like to thank, I don't see him anymore, but Health Springs Inn for providing breakfast. Thank you for bracing the rainy weather to get out this morning. We have a couple people here I want to recognize this morning. Miss Linda Butt, she is our CEO. She's been our CEO for, President CEO for 22 years.
Now she's telling my age.
She's not been here in a while, so we're glad to have her here. And I'm going to pass the baton over to Dr. Mark Dalle-Ave, who needs no introduction. I'm sure you all know him. But he's going to give a talk, a medical talk.
Hi, my name is Mark Dalle-Ave. I'm one of the providers at the Rogersville Medical Complex for those that I should stand up. For those that don't know me, I appreciate the opportunity. Barbie asked me last Friday if I could come and say a few things about health and different factors that affect health. I'd like to start out just giving some kind of interesting thoughts. In 1900, 124 years ago, what would you think was maybe the life expectancy on average in the United States? Any ideas at all? About 47 years of age. By 100 years later, in 2000, 24 years ago, that had increased up to 74 years. It largely increased because of the advances in the antibiotic area, so that people could be treated with pneumonias, and they could also be treated if they had infected wounds and those kind of things. In addition to that, there was a dramatic improvement in our quality of health concerning our heart disease, recognizing hypertension and other risk factors, and trying to treat that early. It's interesting that we think about that, and yet in 1475, an individual named Michelangelo was born in Italy. And in 1563, he was 87. Somebody came up to him and asked him, what are you doing, Michelangelo? He said, I'm still learning, still learning. A year later, he died at 88, but incredible life. One of the things that we think about with health is keeping active. George Burns was born 1896. He was 99, and a person said, how do you keep doing all this? You just signed a contract to perform at age 100 in Las Vegas. And he said, every morning I get up, or when I wake up, I get up and I do something. I may exercise, I may read, I do something for my body, something for my health, and I just keep going. Unfortunately, he did live shortly after 100, but he had to cancel. He got the flu, and he had to cancel that performance that he had contracted for. One of the things I want to mention is the importance of trying to keep active, and that's true no matter what age you are. It's great for youth to be active. It's great for older individuals. One of the things we're trying to encourage is for our older folks to be involved in either Tai Chi or yoga. Does three main things for them. It increases their flexibility. Their shoulders move better, their hips move better, their knees move better. It increases their muscle strength, and it also helps lower the risk of falls. Those three things. The flexibility of the joints, the muscle strength, and the improved or decreased falls. Better balance. A lot of organizations talk about how much one should try to exercise. And exercise can be a lot of different things. If you're in a line, you can just go up on your toes and back down at the store. It can be parking a little bit further away. Studies show that if you try to exercise about 150 minutes every week, like 30 minutes 5 times a day, you get somewhere around 70 to 75% improvement in your heart and your vascular system. If you double that, going all the way up to 300 minutes, or about 60 minutes 5 times a week, you're getting right around 95, 98% of your heart's maximum health condition and your vascular system. The importance of exercise is tremendous, and the other area I want to briefly mention, let me also mention exercise helps lowering your blood sugar, it helps improve your heart health, lowering your blood pressure and cholesterol, it burns up calories, helping manage weight, giving you more energy, lowering your stress, and improving your sleep. And feel free if there's any questions or anything, and I hope I don't make any mistakes. I've made some notes, but feel free to ask me or clarify anything. Another big area that we talk about is nutrition. Every time you go to a store, you're always going to see the nutrition label. And the nutrition label is going to especially tell you what the portion size is, the number of calories, and how much protein, how much fat, and how much carbohydrates or sugars are in that serving. Remember, there are healthy fats. Fat gives food its taste. The polyunsaturated fats, like in avocados and walnuts, nuts, the olive oil, those kind of things. Remember also, you can have both vegetable protein in the beans, legumes, as well as in, of course, animal protein. And remember, there's quite a few good healthy sugars, the sugars that occur naturally in foods, the blueberries, pears, apples, as well as some of the healthy vegetables, the asparagus, broccoli, spinach, those kind of things. Also look for your vitamin content on your nutrition labels. Many foods have some type of vitamins in it. We basically have 6 vitamins altogether. 4 of them, A, D, E, and K, are stored in our body in our fat cells. D is often low simply because it's not in a lot of foods that's in the average diet unless it's fortified in milk products and things like that. In addition to the 4 fat vitamins, A, D, E, and K, are the 2 other water vitamins. The water vitamins, you can take 100 times the amount that's recommended and you will never get toxic on it. You're just urinate them out. And those are the B and the C. And of course, B is quite a few. It's B1, B3, B9, B6, B10, B12, and then the vitamin C. The other thing to kind of be aware of, the size of foods. This is 20 years ago and this is today. They mentioned a bagel used to be 3 inches 20 years ago. Today it's 6 inches. Muffins used to be 1.5 ounces. Today they're 4.5 ounces. Sodas, obviously, and other foods are all increasing in their size. If you come in contact with an older person, again, try to encourage them to get involved in the other Silver Sneakers. Some of the churches have these balance programs with again, the Tai Chi or the yoga. Try to promote healthy habits. Try to warn young people the risk of vaping as well as tobacco products, as well as alcohol use, etc. Physical therapy department gave me this folder here, and I have some samples of these here if anybody wants to take home. This is a program called STEADY, S-T-E-A-D-I, STEADY. And the ST means stop, the E means elderly, and the ADI is accidents, death, and injuries. A lot of people, as they get older, they don't really worry so much about their death. They worry more about pain, suffering, humiliation, struggles, the motive they're going to die in. Encouraging them again to look at the risk for an older person. You can do home assessments, trying to find out what all is a concern. when somebody does fall, there's three major concerns. One is an injury to a hip, like a broken hip. Another is an injury to their back, their spine, compression fractures in particular, where the spine kind of compresses on in itself. And then the other concern we have are head injuries. We can have a simple concussion when somebody falls and hits their head. We can also have the bleeds that occur. There's the epidural and the subdural. The subdurals are more common, unfortunately not quite as serious, although any bleed in the brain can be serious. And then the epidurals, which is the bleed between the bone itself, the skull, and then the layer of there's three layers that cover the brain, and it's the outer layer, the dural model. The epidurals, those that, let's see, am I doing that on time? Are there any questions about anything? Yes.
30 minutes of exercise a day, is there any better time of day to do the early in the morning, the evening, middle of the day? Does it seem to work better?
Great question. As far as the definite scientific, I'm not 100% certain. I will tell you though that they even say, there was a study I saw about 2 years ago, and it said, what if you do 75 minutes on Saturday and 75 minutes on Sunday afternoon? And as far as death and illnesses go, both groups were equal. They encourage people to do the exercise on a kind of a weekly basis. It's appropriate to occasionally skip one day, but they say even if you have to skip several days. Another thing when it comes to exercise, we think of two main groups: the cardio, where you're getting your heart rate up, you're breathing a little bit faster, you're maybe getting some sweating involved, and then the resistance. And they're equally important. In fact, for diabetics, they actually say the resistance, we're using stretch bands and different things like that. Some of the free weights, even lightweight free weights. That's actually more important from a diabetic standpoint than the actual cardio, where you're getting your heart rate up. But really, whatever a person likes doing, walking, bike riding, stationary bike, street bike, anything is ideal. Yes.
I don't know if you know, but B vitamins you mentioned.
Yes.
Is a B complex okay, or is it better to take them separately as you need them?
No, B complex is great. And if of all the Bs, the most common one that's probably low is going to be the B12, and that one is one of the more complicated ones. If this represents B12, you have to eat foods that have it, and then when it goes to the stomach, the first thing that happens is it binds on the B12 is called the extrinsic factor, and the stomach makes something called the intrinsic factor. It goes through the small bowel, and in the very last part, it's the duodenum, duodenum is the very last part, and then there's a special door that allows the complex to enter into the bloodstream in the terminal ileum. So if you have stomach problems where you've got some reason that you're not making the intrinsic factor, or if your diet doesn't have the extrinsic factor, or if you have some kind of a inflammation in the colon, like Crohn's disease, where the terminal ileum is often involved, there's a lot of reasons that people often are low. And B12 again is good for the healthy nerves and things like that. Good for energy. Sure. When these are two, this is says Lucerna Protein Smart, and this just says Ensure Original. This is more meant for a person who is maybe overweight and trying to get healthier. Maybe they're a diabetic, and it has more protein and less sugars, where this one has more sugar and more fat. is for that frail elderly individual that's trying to gain weight. When you look at something, sometimes they look like they could be healthy, and then you have to really read the nutrition. And sometimes you say, well, that may help me, and then you actually realize, and this has not been opened up, this bar is not really as long as what it looks like. There are downsides and positives. I want to spend just a few minutes talking a little bit about how blessed and pleased I am to work at the Rogersville Medical Complex. Last week, there was a longtime patient of mine that had returned from a trip and was having some respiratory symptoms, and he did a home test, and he's a veteran that was positive for COVID. And he contacted me, and we sent him in Paxlovid for his symptoms to help lower his risk of having anything serious. He contacted me a couple hours later and said he went to a national chain pharmacy in town, and because he's a veteran, he gets most of his medicines through the VA. And he told me, and this is no joke, that for 5 days of that medicine, it was $1,000, $200 every day. I made one simple phone call to Suite 1, which is our pharmacy, and he, 2 hours later, told me he got it for nothing, no charge. I want to talk about each of our suites over there. I'm going to put 2, 3, 4, and 6 all together. Those are providers. They do counseling, they do pediatric care, they do adult care, they do aesthetics, trying to look good and feel good and be healthy and be screened for cancers, and hoping you end up like George Burns. It's always a blessing. And all the providers have different backgrounds, they have different interests, they all work together as a team, and they're all very eager to help one another and share their knowledge and experience. It's always going to be, I remember when I was a intern resident in Michigan, and one of the first months I was on a pediatric rotation, and I admitted a 8-year-old kid with cystic fibrosis. The first thing his mother asked me if I had any experience or any knowledge, and I said no, I've never had any knowledge at all of cystic fibrosis other than the few things we learned in medical school. And she, within 1 hour, made me feel very comfortable about telling me her experiences, what typically problems cystic fibrosis patients had, from the respiratory and the GI problems, which just kind of emphasizes you can learn so much from anybody. They don't need to have a certain, her degree was MOM or mom, so. Number 5 is our lab and our radiology section. There's an individual with cancer, and that individual has already had surgery, but they decided to have a chemotherapy once a month. It only takes a very short time, about 15 minutes, and the facility they're going to is out of state. And right before they have their chemo, a few days, they need to have certain labs to make sure the renal function and their blood count is all doing fine. The lab was able to take his blood here. It's sent over to Knoxville that same day. It comes back the very next morning. It's sent automatically to a specialist at the out-of-state facility. By the time he arrives there, he goes in less than 2 hours. He's on his way back to Rogersville. The lab and radiology sections, there was a patient a couple of years ago noticed immediately that he just didn't look well. He was fairly thin. He says he's got abdominal pain and no appetite. The lab worked him in that day. They did an ultrasound. It was just a simple ultrasound. It showed a large pancreatic mass. Unfortunately, it did turn out to be pancreatic cancer, but that saved him and his family a long time waiting to know is something wrong and possibly getting lost and things like that. We talked about falls today a little bit, and if somebody wants to know the risk of falling and breaking a bone, whether it's a hip bone or anything else, doing the bone density, which is recommended at certain ages and certain risk factors. And the radiology in the lab is always eager to help us. If we have a question, they're either contact their radiology people in Knoxville to help us out, or their laboratory people in Knoxville. Let's see, I'm going to skip 7 and 8 for a second and come back and then go to 9. The physical therapy and the durable medical equipment in Suite 9, which where the automotive section used to be, is incredible. The equipment they have, again, this came from the physical therapist, and I've left a few things up here. You're welcome to help yourself. This is preventing falls and things, and I've got another one that shows risk factors for falls, brain concerns. Some people, when they stand up, their blood pressure drops. Some people, their heart output is weakened. Some people are on medications that increase risk of fall. Used to, they would, when we would make rounds in the hospital, they'd say, give me 20 reasons for a fall. And then if you said medications, and they'd say, give me 20 medications that increase falls and things. But at any rate, you have sometimes a child coming in from Chattanooga or somewhere with an elderly parent. They come in, they find out that they can see the provider that day, they can have labs and x-rays done, they can do the stop the durable medical equipment, maybe pick up some kind of a brace or something, maybe they've got a foot drop and they're needing to lower the risk of falls. What did you say? And the last thing I want to mention is Suite 7 and Suite 8, our information technology and our administration, and I include in that the housekeeping and the maintenance. I was born at a time when there was not a great deal of computers out there, and I am the slowest to learn when it comes to technology, and I am constantly depending on them. And the administration that continually works to get all the grants that allows us to have everything we've got, to have that in one bill, to know that the physical therapy people are just so easy to work with. When I call them, they're always eager to help us out. Again, I appreciate talking to you. I did bring a few. There's sometimes you like those little magnet things or stickers for your phone on poison. You never know when there may be a poison, and I brought a few things. I'll leave over here if anybody wants to. And I'm no hurry if there's questions after, but I'll let you finish up.
Can I say?
Yes.
You know, Dr. Dalle-Ave's writing on a lot of people, and he is a walking book, as you well you can understand. But that's, you know, you want that when you are ill or when you're sick. You want someone to be serious in the nature of their visit, to listen and to understand. So I want to brag on him. I want to brag on everyone down at the complex. Dr. Dalle-Ave, a lot of you know this. I know you know this, but any Friday night you're going to see him on the sidelines. That will help pace him to do that. But since he's been here in Rogersville, he has came and embrace this community, embrace what we have here. Also, you're gonna find him pretty much in April, May, he puts together a huge sports physical day. Those here that's had children, you know exactly what I'm talking about. Rural health staff, he invites them, he encourages them to come and help, and we try to do that. And gosh, I guess most of the time we see 150 or 200 for their sports physicals for free. And the donation that you give goes back to the schools. It does not go into Rural Health's pocket. I just wanted you all to know that. Now his sidekick, Miss Carolyn, she's been by his side for
30 years.
They're telling their age now. Work with him, and certainly we're very, one thing I said at the very beginning of coming to Rural Health, just like Tezzy Roosevelt, the staff and the wonderful people there were already there. And, it was just great for me to be able to jump in there and work with them to establish. A lot of people don't know about Rural Health. We have a clinic and maybe two in each county in Upper East Tennessee. So we go all the way to Roan Mountain, all the way to Mountain City. We have them in Bulls Gap, that's the other Hawkins County clinic, but we're called a federally qualified health center cluster. And he mentioned grants. We've outgrown our grants. The federal government, the few dollars they do give us, it goes to people who walk in and cannot pay. And that, over the years, there's been more people walking in that can't pay than any grant dollars that we give. So we have to find ways. So we have great providers, we have great people and staff that want to help you. And I do want to say that, again, if you have a need, call us. We'll try our very best, one way or the other, to find a way. Thank you for coming today. All of Dr. Dalle-Ave's talk kind of made me feel guilty about eating bacon. So I'm probably going to hide and eat my bacon. But I told him, I said, don't tell my doctor what I'm eating today. So thank you for allowing us. And again, we want to thank Joe down at Hell Springs. We want to thank Barbie. Brandy Fugit is in IT. Sherry is my sidekick. And again, Brandy's husband works here at the gas company. Sherry's husband is in the sheriff's department, and she just had her son come back from a mission that we don't know where he was, but God blessed us and brought him back home. Barbie's from Greenville. If you ever see any of the murals downtown Greenville, that's her husband. He paints most of those. If you are at Rural Health anytime soon, look at the new paintings that we have of community things, and he did the painting. So look at the walls. And again, we always are so blessed to work with Carolyn. She retired. We had a big celebration for her, and I said, I can't do life without you. So she comes, 2 days a week and helps us out. So she's our community liaison.
I have a question.
Sure.
To be a patient at Rural Health, do you have to be a certain income, or does it have to do with insurance of any kind, or anyone can be a patient there?
Anybody can be a patient.
Okay.
And
That's
what is
something
the
that I've
beauty.
wondered about for a long time.
That's the beauty of it, is that someone that's coming in and paying us $10 for that service is sitting by someone that has the best insurance that money can buy. You're not gonna know it,
I was
because they
always
don't
under
know
the
it. The
impression-
providers don't know. They don't know how you're paying. They don't care, and that's truly wonderful, don't you think?
Yes.
So, but anyway, thank you so much, and I didn't mean to take the time, Barbie, but I wanted to
No,
brag on it.
I'm glad you did.
I wanna
We just
brag
have
on
a
Dr.
few gift
Dalle.
certificates. I know we're running a little,
Doing those free physicals, because it is a barrier for some of our students. They don't have the ability, maybe they don't have the ability to even get to a doctor or have a doctor to do a physical. So we are very thankful for that. But I know Dr. Williams would like to stand up and talk a little bit more about something way more special.
Just real quick, and that was a great presentation. I didn't realize all the things that Rural Health does for the community. But I wanted to add one thing. If you didn't see it in the paper a few weeks ago, Rural Health is also very committed to the community at large, and in particular in education. In addition to providing sports physicals, we've worked with Rural Health in the past with clinics in our schools, but just recently the consortium agreed to donate I don't know if you'd call it an RV or a motor coach, but one of the old mobile medical clinics, they donated to the CTE department, and we are currently, albeit slowly, converting that into a mobile CTE lab that will move around to our middle and elementary schools to let students get some hands-on activities that will kind of prep them for the CTE programs that they'll see in the high schools. So we're really excited about it and very appreciative. It's an extremely generous donation. So we just wanted to recognize them for that today. Thank you. Thank you all. It's nice to meet you. Yes.